Hi, thank you for joining us today. I'm Dana Sanneman, the Executive Director of Public Affairs at Mount Sinai, South Nassau. I'm pleased to be joined today by Dr. Janet Conscalero. Dr. Conscalero is going to speak with us a little bit about managing stress and anxiety during the holiday season. I'm also going to ask her to talk a little bit about anxiety and depression versus seasonal affective disorder. Janet, thank you for joining us. I'd like to just ask you first, is there a such thing as seasonal affective disorder, and what is it?
So there is a thing called seasonal affective disorder, and generally speaking, it is diagnosed by a change of mood that occurs when there is an increased amount of darkness. And people do notice that their mood changes, but they're profound mood changes. And it's distinguished between what is a real depression and people who don't like the winter, who feel sad in the winter. Those are two different things. So we have to be careful. We have to treat seasonal affective disorder with light. That is the treatment. And depression that occurs in the wintertime is treated differently.
So I know that makes us all depressed when all of a sudden at 4:45 it's dark and you can't go outside. And then the cold weather is depressing for a lot of people too. Now, when you take those two factors and then you add in COVID-19 and the restrictions that we have right now on being with large groups and going out, how real today and this year are these seasonal affective disorders?
Increasingly, our research is talking about the social determinants of our health, our overall health, our wellness, our emotional health, and our physical health. And one of the most important determinants of health is connectedness, is having a social group, a family group. Isolation is both a cause of depression as well as a result of depression. And with the COVID-19 restrictions, we are, if not asked to isolate, we are forced to isolate, and there are real fears of coming together. But there are definitely mental health as well as physical consequences to that.
So last year, Mount Sinai, South Nassau had a Truth in Medicine poll. That's our quarterly public health poll, and you participated in it. And we spoke about stress around the holidays. And reasons people gave for stress were unrealistic expectations, financial pressure, and excessive commitment. So this year, I don't think people have as much struggle with excessive commitment, but these are all factors that add stress around the holidays. What advice can you give people about avoiding planning the perfect holiday? What can you do to kind of relieve some of that personal stress you put on yourself?
Yeah, I think this holiday is like no other. I think this holiday season is like no other. And I think we, number one, have to come to an understanding of that this is something none of us have been through. We don't know how to do it correctly. We don't know what is to come in the next couple of months. So number one is just to kind of accept that this is not like anything else we've ever been through. And then number two is, instead of what can't I do, what am I restricted from doing? Really dig deep. What can you do? What is possible for you? And that cannot be prescribed. One family might come to one conclusion, another might come to a different one, but it is important to ask themselves the question, what can I do? Not what can't I do?
And, when our minds are going, and we're constantly feeling stress, our bodies also start to feel that stress. What areas of the body are most impacted by stress?
It's really an individual issue, right? So some people hold their stress in their shoulders, and others will complain of stomach aches, right? And others headaches. I think number one, we have to honor the fact that our bodies do tell the story. And even in our children, their bodies tell the story. And when they're complaining about things, headaches and stomach aches and things like that, although they may not have physical problems, we need to understand that they're trying to tell us something, and our bodies are trying to tell us something. So number one is to get to know what your weak spot is, where your vulnerability is. And then number two is to look at, again, what is possible. It is winter. Gyms are restricted. We're really limited in terms of the number of things we can do to be physically active and fit. So sometimes it's really looking at, boy, I never thought of doing that, but I'm going to try it. So if that's yoga in your living room, then go ahead and try it. See if it works. Open your mind up to a different possibility, and sometimes your body will follow.
Now, if some people ignore your great advice and they just keep on with the health symptoms that they're feeling, and especially if it gets more serious, what are some of the more serious health consequences that people can see when they don't properly manage their stress?
Well, so from the head to the toes, right? So there's dental health, believe it or not. Grinding your teeth, holding your jaw tight has effects not only for headaches, but it has effects on your teeth. Feeling that your heart is racing or heart palpitations, things like that. Feeling that your stomach is not settled, that when you eat, you feel overly full or you feel nauseous, things like that. And even things like cramps in your legs and in your muscles really indicate that your body's holding a lot in.
Now, as a clinician, I know that you do see people who really have anxiety. And as a professional, how do you diagnose and distinguish between holiday stress and real anxiety and depression?
So it's a continuum. We're human beings. And so human beings have anxiety. It's how we're programmed. We're supposed to. It's a signal. It's a signal that there's danger. So if we didn't have anxiety, we wouldn't recognize danger in the world. So we have to understand that. But number two, so on a continuum, some people have mild anxiety. It doesn't get in the way of going to work, say, or it keeps them up one night, but they sleep the rest of the nights. So sometimes those things are managed very easily. As you move through the continuum, what you look at is the anxiety gets more and more in the way of you doing the things you want to do. And your thoughts become more and more present as a part of that. So for example, we all might have anxiety about, for example, getting COVID, right? People think about it. And so we might think about it, and so we all wear masks and we wash our hands and we do all of our due diligence. And so I can say in my brain, I've done everything I can do. Other people with more persistent anxiety, they can't get that thought out of their head. So they can do those same things. They can wash their hands and wear a mask and be careful. But for them, the thought creates another level of fear. And so it stops them from doing the things they can do. And it then makes their behavior reinforce the fear. And that's when you want to really start looking into some kind of a therapy.
So as we look now, we're past Thanksgiving, we're getting into Hanukkah and getting into Christmas. What are some of the biggest predictors of depression around the holidays? What should you really look out for?
This year has challenged everybody to figure out what's important to them. And sometimes the thoughts that accompany depression is nothing's ever going to get better. I can't change anything. I'm helpless in the world. Those kind of thoughts really drive depression. So having opportunities to challenge those thoughts, number one, is a very helpful thing, very helpful. But if you can't find those opportunities, if they're not present, if you can't have a friend to talk to or a wife, a husband, someone to help you balance those thoughts out, you really do need to look at, well, what is driving this for me?
Dr. Conscalero, any advice for people that you can give them in these next 2 weeks on how to really, truly enjoy this holiday season?
So the first is, do not compare it to last year, year before, or what you wanted to do. That's number one. Making meaning out of this season may be different than others. So, for example, if you had the best holiday of your life last year and you had all your family and you cooked and you baked and those were the things that you look back on, this holiday might feel diminished to you. But what can you take from that? Do you still love to bake? Do you still love to cook? You can cook and you can bake, even if you don't have 25 people over. You can still do the things that give that holiday meaning to you. Please do those things. And don't worry that it's a big pie and only 3 people are going to eat it. It's okay. So finding those things that give you meaning puts what's important back into the holidays. And for some people, they need to plan, right? So I know where I'm at and I don't like it, but I need to think, what's Easter going to be like? And I need a light at the end of the tunnel. And so you can do that too. You are allowed to plan. But being in the moment, being mindful that I'm taking with me what's important is very helpful. Not what I lost.
Great advice, I think, for all of us. And as we close out 2020 and we're looking at 2021, I know everyone's, you get holiday cards and everyone's like, good riddance to 2020. Everyone's really looking forward, I think, to a new year. So if we could just offer everyone advice on how to really embrace a new year and how to be ready to start the year anew.
This year has tested everybody. And I don't know if everyone takes away the same thing from their experience, during this year. Some people's experiences have been one of tremendous loss.
Right.
Other people's have been one of tremendous inconvenience. Other people have found a real interest that they never had before. For example, they're working from home. They've been able to watch their kids more than they had before. So for each person, there is a different experience. And so not to be Pollyanna, we all came out with something great, or conversely, oh my God, this was the worst year ever. For most of us, it wasn't so great. But it really is about looking to see, is this a time where I can reevaluate? New Year's is always that time. So can we take this time and really evaluate and reevaluate? Number one, what's important to us? How we're treating each other. Are we tolerant of each other? Really tolerant of each other? And not just tolerant, but respectful. And is that something that we can take into the new year? A real sense of, we got through this together. Even if we all looked at it a little bit differently, that if we could get through it together, it would be a win for everybody.
Dr. Janet Conscalero, if members of the public out there who are watching are looking for more information on what you're speaking about, or if they're looking to make an appointment with one of Mount Sinai South Nassau's mental health specialists, where should they go?
So we have one number. It's 516-377-5400. If you're looking for behavioral health services, if you want to ask questions about primary care services, stomach aches, headaches, you name it, call the number. Someone will help you.
Thank you to everyone for joining us today. You can find our series of videos on our social media accounts at Mount Sinai South Nassau. I'd like to wish everybody a very happy holiday season and our best wishes for a healthy and peaceful 2021.